Patricia Zamora, thanks for joining us today. Can you start by telling us a bit about yourself, the clinic you're part of, and what locations and where you help people with TRT?
Sure. So I'm Patricia Zamora. I like to consider myself a men's health nurse practitioner. I am a family nurse practitioner. I have been doing men's health and testosterone replacement for about 3 years. I am a part of a clinic here in the Texas area called Peak Performance and Longevity. We treat patients all over Texas, but for coaching consults, we can treat patients all over the world, or at least give very, very good advice.
That's great. And for those who might not know exactly, what exactly is a nurse practitioner, and how do you fit in the world of medicine and helping people with their TRT and health?
So a nurse practitioner is an advanced practice nurse. Typically, from a good school, you have to be a registered nurse and have a few years experience as a registered nurse. After that, you go into a master's program with a respected specialty. Mine was family nurse practitioner. At the school that I was at, there was family nurse practitioner programs. There were pediatric, there were women's health, there was geriatric, but there were no men's health nurse practitioner programs. So that got me kind of thinking, once I was close to graduating, hey, I'd like to do something in men's health because I don't see anything like that out there. And my preceptor at the time was a gentleman, a nurse practitioner in men's health himself. And he said, there are no programs like that out there. You just kind of have to graduate and then seek out the information and see what you want to do that's related to men's health. So while I was still in school, I was Googling, men's health program, postmasters and all these kind of things. And that's when testosterone therapy just popped up left and right. If you Google men's health, it's just TRT everywhere. And this was about 4 years ago. And so I said, okay, well, what is this testosterone therapy? And then I just started going down that rabbit hole of what is TRT, taking my own, classes online about testosterone therapy and men and men's health. And then from there, I went and started applying at different clinics throughout the first year of my practice while I was practicing somewhere else, different T clinics. And it was at those T clinics where I realized that I wanted to do it better for my patients because I didn't feel like they had the patient's best interest in mind with the way they did treatments there. And so that led me eventually to find Dr. O'Connor and to start my own.
Patricia, what are some of the positive aspects of TRT therapy that you've seen with the men that you've been helping?
Everybody talks about increased muscle mass or help with weight loss or energy, increased libido, improved sexual function, erections. But for me, the most rewarding is seeing these guys that are in their 50s and 60s, maybe divorcees, kind of given up, so to speak, with dating or with just life in general. And to see them now dating again, to see them now asking, hey, she doesn't have kids. What can we do if I wanted to have kids at this point? To see them really having a renewed zest for life and vigor, to me, that has been the most beneficial outcome of testosterone replacement therapy.
Well, I guess there's a flip side to it, right? So what are some of the potential negatives and risks associated with TRT, and how can you help them?
Well, I think you've got to put it in two categories, first of all. Is it TRT or is it just TT, right? Is it replacement therapy or is it just testosterone supplementation? If you're truly doing replacement therapy, meaning you need testosterone replaced, or at least up to where it would be naturally at your age, then there aren't a lot of untoward side effects. A lot of it's going to be dose dependent, and highly individual. But, for everybody, I would say obviously decreased fertility. You need to watch your ABCDs, like Dr. O'Connor basically invented, your A1C, your glucose, insulin, your blood pressure, all of those things you need to take into consideration when doing testosterone therapy. But if you're doing it at a therapeutic dose and you really needed it, then it shouldn't cause any issues along that line. Where I see a lot of the side effects or the untoward effects with testosterone therapy is for guys who are going above and beyond their therapeutic dose because they want to maintain a super physiologic level for other goals, say, bodybuilding type goals or that sort of thing. And that's when you run into trouble like erythrocytosis, where they have to donate blood every few months. That's when you run into trouble like the high blood pressure, swelling, like bloating, like the increased estrogen that they don't want that's actually good for them. So that sort of thing. So first you need to break it down into TRT or just TT.
Are there any concerns with people having just a normal level of testosterone. So if they have low testosterone and then they want to be able to have a normal level, does some of those challenges come in? You were mentioning about super physiological levels of testosterone and having erythrocytosis, high hemoglobin, high hematocrit. Is there people that just normally taking a little bit of testosterone, getting them back to a normal level will have problems come up?
Yes, I think so. I mean, I know so. I've seen it in patients. There are genetic predispositions for some of my patients to get a really high increased hemoglobin, hematocrit, red blood cell count, even on smaller doses. For them, in something like that, you've got to understand, though, it's not just testosterone alone that causes things like that. It's everything else that they're doing, and that is just another element or icing on the cake. For instance, are you smoking? Are you chewing nicotine patches? Are you slightly overweight? Do you have sleep apnea? Do you exercise? And then if if all of those things are negative or not good, and then you add testosterone therapy on top of that, even if you're doing a very, very low therapeutic dose, yes, that's when you can definitely run into problems.
Very interesting. So what brought you to becoming a testosteronologist, and what was your journey like in connecting with Dr. O'Connor? And since starting this a few months ago, where are you at today? What's the journey been like?
Okay, so I've been wanting to talk about this because I know you and Dr. O'Connor always mention, hey, Patricia, you were the first one to jump on the fellowship program. Yeah. You were the first one to jump on and everything. When I started working at one of the big box T clinics, I started working at about a little over 3 years ago now. I'm looking at the date, over 3 years ago. I got there, remember, I had already, before I started there, done my own kind of TRT education online and kind of, just basic Q&A stuff and just learning about it. So I get there and I'm enjoying the process of seeing the patients, and I'm loving T therapy for guys. But as I went along right in the beginning, I started noticing that while a lot of guys were getting benefits and getting help from this therapy with the way they felt, and they were coming in every week and they were feeling great, a lot of guys seemed to go the other direction. And I felt like there was something missing. I felt like the clinic and, we were missing something. And as providers at these T clinics, our hands were tied. We saw, many, many patients a day. There wasn't time for the ABCDs. There wasn't time for true education with these patients, a holistic way of caring for these patients on testosterone. I knew there was something else. And so one of the providers there actually said, well, hey, if you want to learn more, you should go to the Anabolic Doc online. He's got a lot of great information about this. And the irony is that the person who suggested him didn't really follow Dr. O'Connor's protocols, because he couldn't either, because his hands were tied at the clinics, but it were golden handcuffs, so to speak. So anyway, so that's why I started following Dr. O'Connor, a little over 3 years ago. I was like watching all his videos. I would be sitting on airplanes watching his, erythrocytosis video. Like, I've always wanted to learn more about this and how to treat men on androgens and testosterone the best and the safest way. And so that's how I found him. And so it just so happened, 3 years into just basically stalking Dr. O'Connor on the internet, yeah, that I went to his website, just seeing what new he had. And I saw that he had a fellowship opportunity for providers. So I was like, oh yeah, I'm gonna jump on that. I'm jumping on it. Yes, absolutely. And so the rest is history. And so here I am now, certified testosteronologist. I have enjoyed every single week that I'm able to meet with him and pick his brain. I've got a great case for him today. I want to pick his brain about. But so far, it's been wonderful, having him as a colleague and working with him and being mentored by him. He's a wealth of knowledge, and I just am so grateful to be here.
That's interesting. Going back to what you said, it sounded like there was a set standard procedure for helping men in some of your previous clinics that you're a part of, and it sounds like you're trying to determine the unique characteristics or situation that men are in, and then helping them individually. Almost, Dr. O'Connor calls that fingerprint medicine. Each person has a different fingerprint, and they're going to have a different journey. Some guys need to lose 20 pounds in order to be a part of that. In addition to getting, there might be a lot of things, and getting their blood pressure down. But there's this holistic ABCD S reviews of that. So that's interesting. So how does the treatment process typically work from initial consultation to ongoing management? What's it been like for some of your guys?
I worked at a clinic that was also an online clinic, pretty popular for hormone replacement as well after the big box T clinic. And while this clinic practiced evidence-based medicine, and I really appreciated the way they practice medicine for the patient, I would only see the patient once and then I would never see them again. Or if I got lucky, I may see them a year later. Mm. I don't like to practice medicine like that. I feel like with testosterone therapy, I feel like I'm more of a testosterone therapy / health and wellness coach. And I want to follow my guys throughout their journey until I know they got this shit. And then I still want some check-ins every couple months, see how you're doing, because things can come up. With the therapy, your body changes. Like you said, it's fingerprint medicine. We're not machines. We're not the exact same day in and day out this month and in 6 months. So why would you only follow up with the patient once a year, right? So with my practice now, if a guy is interested in joining my membership or my team, we have an initial consultation. We see at that initial consultation if we were a good fit for each other. And if the gentleman wishes to proceed and join the team, then I send him off for a really comprehensive lab panel. He gets that lab panel drawn, he comes back, and we have a very, very long visit where we go over all of his labs and we formulate a plan of care together for him. And then just depending on what medication he is going to be on or his route of medication, typically we'll get some follow-up labs in about 6 to 10 weeks later. And then after that, three months. And then after that, every 6 months. But it just varies after that. Each individual guy may have other things that we need to check at a more frequent basis. Of course, if they elect to check something more frequently, I'll always order the lab for them, no problem. It's better to know than to not know. But yeah. With my guys, like I said, we do more of a concierge type TRT. I do have guys who do like more frequent check-ins, maybe every couple of weeks. And then I like guys who at least know that I'm here if they do need something and they don't have to wait weeks to get in to see me or months to get in to see me. They can see me pretty quickly.
That's great. And what are the services? I think you've discussed to me personally before. You have a couple different services that you're providing people. Could you describe those a little bit?
Yes. So we have 2 different programs that we provide, guys. One is a basic TRT, Anabolic Recovery Medicine, where I help you with your testosterone. I'm mindful of the ABCDs, which means I'm mindful of any kind of comorbidities or metabolic issues that you might have. And if they're caused by the testosterone, I will treat it, of course. But if they're not, I send you back to your PCP. I'm not doing any kind of primary care medicine for you. It's just testosterone therapy. Then I have one that's what I call my all-in membership, where my guys elect to have me basically as their PCP, who also does their testosterone. And I monitor their ABCDs and I treat the ABCDs as to my ability as a nurse practitioner. If something is above my pay grade, so to speak, I will send them to a specialist, cardiologist, endocrinologist, hematologist, that sort of thing. And then I also kind of act as a health coach to them. They get newsletters with nutrition and training advice. They can always ask me for those things, and we can have an impromptu, unscheduled visit on how to structure their diet or that sort of thing. So they get that. And with the all-in membership, the concierge membership, they get the Testosteronology app included.
Oh, that's awesome. Lastly, what advice would you give someone who's on the fence? What should they be thinking? What should they be feeling? Maybe they got their testosterone levels checked and they're on the fence. They really don't know where to turn. What should they do next?
Well, first they need to gather all their symptoms that they think can be attributed to low testosterone and really have an internal dialogue as to whether they think the symptoms are caused by low T or not. And if they've ruled out other causes for those symptoms, then I would say get your blood work done. Okay? Get your blood work done. And while you're getting your blood work done and you're waiting for it to come back, think about your fertility goals so that when your blood work does come back, if your testosterone is indeed low, or say it's in low normal and you may be a candidate for T therapy and you want to give it a shot, make sure that you have your fertility goals laid out and all the ifs, ands, and buts regarding that. And then go from there. And then obviously choose a provider that can walk you through every step of that process, I would say also. And someone who's really educates you about the good, bad, and the ugly with T therapy. I wouldn't say there's really much ugly at all, unless you get to super high doses and you're not monitoring your ABCDs. But it's not for everybody. So that's just what I would suggest.
So we also have a group of people out there that have been a little aggressive on using other substances, things like anabolic steroids, Tren, Deca. Do you help people that need to maybe think about next phases of their life and getting off of that stuff and recovering? Do you help people with anabolic recovery?
Yes, I do. It might seem complicated, but it isn't. It's a truly simple process that just maybe takes time and maybe hard for them to get recovery at times, but the actual process is not that. It's pretty straightforward, is trying to get their natural spermatogenesis and their production back up. I also do risk management for guys that want to continue to be on those kind of compounds, and they want someone that's non-judgmental to follow up with them on their blood work and make sure that they're okay. I just had a patient here actually today. His wife sent me his semen analysis. He will be doing in vitro fertilization with her in the next couple of weeks. He started with me at 0 sperm, and now he has 31 million. And he was somebody who, throughout his teenage years and early to mid 20s, was just blasting everything, under the sun that you could think of, and had completely shot, had no sperm whatsoever. And so it took a while, but now we're up to 31 million from 0. So, yeah.
Patricia, how can people get a hold of you if they'd like to get your services?
Well, you can obviously contact me through the Testosteronology app. That's probably the easiest way to get a hold of me directly. Or you can go to our website. It's peakperformanceandlongevity.com. I know it's a mouthful. We're working on it. Or you can send us an email at contact@peakperformanceandlongevity.com. But probably the easiest way is just to click on through the Testosteronology app and find me.
That's great, Patricia. Thank you so much for being part of this, and we're glad you're part of the team.
I am very happy to be here.